say be where you are now. Don't let fear get you down. Hey, you're on your way. Hey, you're on your way. If you give up now, you never know. It may be about to come. Oh, you just don't know. If you get down and going slow, you may never ever get back up. Oh, you never know. Oh, you never know. I felt it when I lived in Texas. It followed me up north to Nashville. No matter where I go, I feel stuck with the shadow I can't escape. I'll sing my songs to anyone who'll listen, and write melodies to sing away the sorrow. I hope you'll sing along and find hope when you're lost, and maybe one day the light will lead us home. If you give up now, you never know. It may be about to come. Oh, you just don't know. If you get down and going slow, you may never ever get back up. Oh, you never know. Oh, you never know. Ooh, up now you never know. Ooh, don't give up now, you never know. If you give up now, you never know. It may be about to come. Oh, you just don't know. No, 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 no. If you give up now, you never know. It may be about to come. Oh, you just don't know. No, 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 no. If you get down and going slow, you may never ever get back up. Oh, you never know. Oh, you never know. Oh, you never know. Oh, you
Now, PACT's President and CEO, Dean Miller.
Good morning and welcome to the PACT Capital Conference 2020. I want to start off by thanking all of our supporters of PACT and the PACT Capital Conference, particularly our founding leaders and all of our sponsors, led by our host, Eisner Amper, our gala sponsors, Grant Thornton and Troutman Pepper, Titanium KPMG and Morgan Lewis. Our platinum sponsors, Blank Rome, Bridge Bank, Duane Morris, EY, Fox Rothschild, and Independence Blue Cross. And finally, our specialty sponsors, Baker Tilly, Cozen O'Connor, and RSM. We are excited to present this year's Capital Conference virtually, and you're not going to want to miss all of our exciting panels and company presentations, as well as our finale, The Lion's Den, on September 24th. Please check your mobile app and desktop platform for the schedule. We will continue this year with our investor meetings, our panel Q&As, in our virtual environment powered by Remo. Lastly, be sure to stick around at the end of our program this morning, where we will give you the QR code to link to Remo for the networking session. I now want to introduce a short video about our host sponsor, EisnerAmper.
I was asked to come back and help our firm develop a cloud accounting practice. The name of the division is EisnerAmper Cloud Accounting. We provide cloud accounting services for small to mid-sized businesses. It includes everything from entry-level bookkeeping, bill pay, accounts receivable management, reporting analytics, consolidation, multi-currency. I think the thing that's unique about EisnerAmper is that we kind of bridge the gap between personal wealth and business wealth. So, I like to say we take care of small companies and their owners. I mean, we also take care of public companies as well. We are a big firm, but we really come down market very well and give the small business, complete support. At the core of our offering is Xero. It's a great application that can connect to whatever we'd like it to connect it to. Some of our go-to apps are Bill.com and Expensify and Gusto. Those seem to be on most of our client implementations. But we also, depending on the industry you're in, we work with other third-party apps that are available on the Xero store. So there's project management type time capture systems. We do a lot in financial services. Our offering is very different. At the beginning, the first call with the client, we have a project manager as part of the team who actually leads the first couple months of the implementation of the solution.
So one of the great things about the EisnerAmper Cloud Accounting is because everything is automated and streamlined, and we have an extremely close relationship with these clients, we're available to advise them in their needs for growth, for finance, any expansions or mergers and acquisitions that they may be interested in as they go through their business cycle and through their successes. The most rewarding part of my job at EisnerAmper is seeing our clients grow and succeed.
It's now my pleasure to introduce the PACT Capital Conference 2020 co-chairs and hosts, partners and leaders of the Philadelphia office of EisnerAmper, Pat Boyle and Paul Doherty. Welcome, Pat. Welcome, Paul.
Good morning, everybody. My name is Paul Doherty, and I'm the partner in charge of EisnerAmper's Philadelphia office.
And I'm Patrick Boyle, partner in charge of EisnerAmper's audit and assurance practice, as well as the technology practice in Pennsylvania. We are excited to welcome everyone to the kickoff of the 2020 PACT Capital Conference.
EisnerAmper is proud to support the entrepreneurial ecosystem, and this conference is an important touchstone each year. Serving as hosts and co-chairs has been particularly interesting this year as we break new ground with this virtual event.
At EisnerAmper, we work with companies at every stage in their development, from early stage startups through to middle market enterprises up to public companies across industry sectors, including a dedicated life sciences and technology team.
And we provide a wide array of services. That brief video you just watched talked about how we work with companies on cloud accounting solutions.
As we get started, I'd like to thank the industry track vice chairs for healthcare, Capilla Ratnam, partner at New Spring Capital; for technology, Glenn Bresner, co-founder and managing partner at Activate Venture Partners; and for early stage, Doc Pargi, managing partner of SRI Capital. Their work created the great content you'll see during these virtual sessions.
We can't do any of this without the support of our sponsors. You'll be seeing more from all of them as the sessions progress. Thank you all for your supporting PACT Capital Conference 2020.
Starting our broadcast this week with 3 great panel sessions. Today with our healthcare panel, we'll be discussing the home as the hub. On the 19th, our technology panel will be discussing emerging selling strategies and approaches. And on the 20th, our early stage panel will be discussing the remote economy.
Stay with us following today's panel for networking in our special virtual environment powered by Remo.
And now I'd like to introduce our first session sponsor, Independence Blue Cross, with Tom Olenzak, Managing Director, Corporate Development and Strategic Investment. Thank you.
Hi, I'm Tom Olenzak, Managing Director of Corporate Development and Strategic Investing with the Independence Blue Cross, and we're proud to be this year's sponsor of the healthcare panel. Today, we're going to be speaking about the home as the hub for healthcare. So recent world events and changes in patient preferences and demands have fundamentally shifted how and where we all consume healthcare services. An easing of telemedicine regulations during this pandemic have allowed providers to more easily interact virtually with their patients, causing a meaningful transition from institution to non-institutionally based care. Healthcare providers were in various stages of preparedness to address this rapid transformation, and all continue to assess their business strategy as this change continues to unfold. Today, we'll discuss this new virtual environment and whether this is a permanent shift, or will the old payment models and regulations be reinstated and pull back the trend? What parts of traditional healthcare delivery will remain unchanged? What technology investment should a provider be making? Join us for a thought-provoking and interactive session as we explore macro healthcare delivery topics with local and regional experts and thought leaders around the country. So now, I'd like to introduce you to Michael Kappa, partner with RSM US, who will be the moderator.
Tom, thank you very much for the introduction, and welcome everybody who have joined our Home as a Hub healthcare discussion. My name is Mike Kopa. I'm a partner with RSM. I lead healthcare services in this tri-state area. Our practice consists of a variety of different types of providers in the healthcare space. RSM is the 5th largest provider of audit, tax, and consulting in the US, and the largest provider of these services to the middle market. I want to give a special thanks to my committee members who helped plan this conference. First and foremost, the Philadelphia Alliance for Capital and Technology for hosting, Kapila Ratnam from New Spring Capital, Tom Olenzak from Independence Blue Cross, and Cheryl Jarvis Johnson also from PACT. So thank you very much. With me, I have 3 great panelists and esteemed colleagues. I'll let them introduce themselves a little bit here, but just by quick background, Gulshan Mehta is joining us from Children's National Hospital, and Gulshan brings a national large provider perspective to the panel, so we were happy to have him. Rodrigo Cerda from Blue Cross. Rodrigo brings a payer community perspective, and Ravi Ganasan from Core Solutions, who brings a entrepreneur and smaller provider perspective from the technology realm. So I'll kick it around the horn here, starting with you, Gulshan, if you want to give just a little bit more of your background, and then we'll go to Ravi and Rodrigo.
Yeah, thanks, Mike, and I'm excited to be on this panel. So as Mike said, my name's Gulshan Mehta. I lead the Bear Institute at Children's National. The Bear Institute is a strategic partnership between Cerner Corporation, the large healthcare IT vendor, and Children's National Hospital, the leading pediatric organization out here in the DC area. And I'm super thrilled to be part of this panel, and I'll turn it over to whoever's next getting introduced.
Right, Ravi, why don't you go ahead?
Thank you, Mike. Good morning, everyone. My name is Ravi Ganeshan. I'm president of Core Solutions. We provide electronic health record software to the behavioral healthcare industry. Typically, companies in this industry range from anywhere from 10 million to 100 million. So relatively speaking, they are smaller providers. In my role, I speak to a lot of CEOs today who are trying to integrate telehealth into their practice. So I think it's a very different perspective when you're a smaller part of healthcare. And that's one thing that I hope to bring to this panel. But also as an entrepreneur, looking at how do you integrate telehealth, how do you innovate with data, and how do you create new business models? Those are things that are exciting, and I hope to contribute to this panel through that perspective. So looking forward to an exciting discussion. And again, thank you, Mike, for this opportunity.
Thank you, Ravi. Rodrigo.
Hi, good morning. I'm Rodrigo Cerda. I'm the Vice President of Clinical Care Transformation at Independence Health Group, Independence Blue Cross. Been here about a year. We are a large blue plan serving the Philadelphia area and have national customers and also serve other regions under the AmeriHealth Caritas brands. I'm an internal medicine doc and public health practitioner. I've also worked as a consultant for several years as well at McKinsey in the US as well as in the UK for the last 2-3 years. So it's really a pleasure to be here. I think this topic is very much on our minds every day. So I'm glad to be able to talk about it with all of you.
Yes, certainly. The telehealth, the current pandemic, all of these things certainly impacting this particular aspect of healthcare delivery. So certainly happy to talk about it today. And I really appreciate all three of you. Obviously, we're under somewhat unusual circumstances, although it's becoming the norm very quickly, in our day-to-day now. But, the venue here, obviously switching from live to a virtual setting. I really appreciate you guys, joining me and joining in this format. I think it's going to be great. So, today, what we're going to try to really convey is kind of three areas of ideas. This whole healthcare at the home, telehealth, is this overhyped? Is it living up to what it's supposed to be? Secondly, what's the future of the regulations and the payer environment? Obviously, a lot of, at least currently, temporary changes were made to make this path feasible for patients and providers to interface. But some of those things aren't quite permanent yet. We want to understand what that future looks like. And really, to Robbie's point earlier, the future of digital health, which is digital health includes a lot of things. Venues like what we're talking here, as well as, there's all kinds of shareable and wearable devices where information is being exchanged. What are the risks? What are the investment opportunities? Those kind of things. So, I think those are the three things we're going to try to touch on most. Obviously, there might be a few other things that we get up to, but if we can drill in there, that's where we're going to stay focused. So, I guess in that regard, Gulshan, I'm going to start with you. Telehealth kind of evolved, I think they say 5 years and 5 months. It was supposed to drive down the cost of care, provide better access, better customer service, all of these things. Has it lived up to that hype, or has it fallen short? What's your perspective?
Yeah, it's a pertinent question. So I think it's definitely in the hype cycle, right? So when we start talking about where it actually starts and at what point within the hype cycle it's probably right around that peak that you would expect. One would call it inflated expectations, perhaps, but that's where it is. And it's going to have to make its way through the remainder of it eventually. There is, as part of the Bear Institute, as I mentioned earlier, strategic collaboration between, a forward-looking healthcare IT vendor like Cerner and then a forward-looking, pediatric organization like Children's National, where we're looking at evolving the reach of care for some of the most nationally recognized providers and the care delivery platforms and so on. It's been a consideration for a little while for us. And we often look at technologies in general to say, where do they fall within that hype cycle, right? Where are they in general? What are some of those enabling capabilities? Telehealth and the telemedicine and all the tools that go out and enable that is no different than several of the others that we go out and evaluate and look at. There's the operational element of it, which has already been in place, was in place infrastructure-wise. We were there. We could have done this a year and a half ago, right? 2 years ago even, in order to go out and have the right amount of bandwidth and things of that nature. And then it eventually kind of gets to the point of, adoption. And adoption-wise, there just wasn't quite that incentive, that motivation within the industry to go out and make that switch. There wasn't quite that event, which the pandemic went out and provided to go out and make that happen. But in general, I think there are tremendous amount of benefits obviously associated with telehealth. You mentioned some of the conversations around the regulations and things of that nature that they'll follow. But I mean, that's going to eventually drive, as you know, healthcare heavily regulated. That drives a lot of technology adoption, a lot of technology proliferation, and all of that. And historically has, and I expect that it would continue to. So we'll know a little bit more about what the stickiness factor of some of the telehealth and telemedicine related solutions end up being. The way we view it as a standalone pediatric organization, and Cerner Corporation in general is, we look at the industry at large and we say, there's right now, we're at a point where a lot of these borders that we have in place in terms of the regional affiliation of several of these healthcare entities, it's a possibility that there is a competitive advantage that they can drive in order to go out and position a brand a little bit better that extends the reach outside of the DC region, perhaps a little bit better. It's the same thing that applies to several of the other, industry leaders in the provider sector as well, where they'd like to be able to go out and increase the reach of some of the high quality care that they can provide using telehealth and telemedicine related solutions more, in a little bit more of with a great opportunity at this point.
So from the standpoint of, a provider here in the Philadelphia market, who may have been more isolated to the Southeast, region of Pennsylvania, this environment, is really stirring that conversation of what other opportunities are there in other parts of the country, or is that what you're saying, or am I?
Yeah, that's exactly where I'm at. So I think this allows for a nationwide as well as global reach to increase for several of the organizations, whether it's in Philadelphia, whether it's in the DC region where Children's National is located. It just becomes more of a, is your competition really more regional, or is it now more expanded past that point? And it allows for that a little bit. So there's an element in terms of competitive advantage that telehealth obviously goes out and provides now that there is greater adoption, at least on the patient and their family side for our pediatric organization when we go out and view it. There's also, the good that comes with, as we've heard in the EDs, right, in the emergency rooms, the emergency departments. This is a nationwide phenomenon. The ED visits are down about 40 to 50% at the moment in general. And what's evaporated from a lot of those volumes is those lower acuity stuff, the things that a lot of those emergency rooms have been wanting to get away from and focus on those higher acuity emergency room visits and so on and so forth. And telehealth allows for some of that, where, if you just have a question or something like that, you can go out and reach out to, Children's National has an emergency room, which allows for a telehealth visit just to do a quick check-in and a follow-up if they wanted to, rather than having the individuals come in. So there's a benefit associated with that as well. And then, of course, all those rural facilities, right? There's who just have never had the access to care or the access to the expertise that they needed. And perhaps health outcomes over there have suffered as a consequence of that. That gets benefited from this as well. So I think that, it's definitely on that curve. We'll probably see a little bit of a realization of the disillusionment, if you would, over a period of time where not everything's going to remain as is. And then we'll probably see a little bit more of a stabilization that happens past that point as we start understanding what some of those niches are, as well as getting influenced by what the reimbursement patterns look like.
Got it. Ravi, we talked about a little bit ahead of the panel, in this regard, the hype, the overhype, are outcomes positive, are they negative? You really kind of talked about it. There's really two kind of organizations. One is the service provider virtual organization, working to meet patient demands. The other are existing providers leveraging telehealth capabilities. So do you want to talk about kind of that distinction between the two, for those joining us for the panel today?
Absolutely. And I think Gulshan provided a nice strategic perspective. I think I'll probably start with the nuts and bolts, as Mike said. And when we think of telehealth, I think there are first, there's the technology and then the service delivery. Now, on the technology side, this event is virtual. We are doing this through video. Our kids do play dates on videos. So the technology itself is fairly mature, and there isn't much hype whether technology can solve this problem. Now, on the service delivery side, I think there are two different business models. One is the outsource model, where companies like Teladoc, I think they're disrupting healthcare by integrating telehealth and technology with a traditionally old business model. And they offer convenience to consumers. They address the demand-supply imbalance. So I think that's one model that is already successful. Teladoc was doing great, and there are multiple companies like Teladoc. They were successful prior to the pandemic. And I think in that sense, I think it is not a hype. They're going to continue to be successful. So, why are we talking so much about telehealth today? I think my perspective is there are a lot of new entrants to the telehealth market. It's the traditional, physician, the primary care physician that has been providing office-based services that all of a sudden, they need to find a new way to communicate with their, patients and consumers. So, and with the pandemic, a lot of the rules have been relaxed. In the past, telehealth had a lot of restrictions. But in response to the pandemic, rules were relaxed, and physicians need to find a way to stay in touch. So the definition of telehealth itself expanded, during this period. CMS would accept a telephone call when the pandemic started as falling within the telehealth. Then we started using, our smartphones. Then we started using things like WhatsApp. So I think there's a rapid, people were trying to find the best way to communicate with their patients and keep people healthy. And I think a lot of the hype is because now we are seeing firsthand, you're no longer able to see the physician. You're no longer able to do things that physically we could do before. So in that sense, I think a lot of the conversation is driven by this new phenomenon. Now, this segment actually, is the one that faces the biggest uncertainty. Things that were relaxed before, if they go back to more stringent requirements, how is that going to impact telehealth adoption? Similarly, reimbursements are pretty constant. There has not been a change. But if there is a change in the reimbursement, realm, how is that going to impact, the primary care physicians and the ambulatory care practices?
Yeah, I agree, Ravi.
So
before we get into that side of it, Ravi, I wanted to get Rodrigo's perspective on. Look, you're paying a lot of claims now, right? Your business is paying a lot of claims. You're seeing a lot of activity. What's the water cooler talk? What are people saying? Is this a positive thing and negative things? Are customers happy? Are you following up on a lot of issues, or is there friction? I mean, what are you seeing as far as how this is actually unfolding and who people who are actually paying for it?
Yeah. Yeah, I mean, this is the new reality. I think it's hard to believe that we're going to go back to where we were before. We went, I think, from something like 300 visits a week to 50,000 virtual visits a week after social distancing measures were put in place, and we were one of the early adopters of saying, hey, this is essential for access to care. And that, I think that's the reality now. I think the other thing that we see, both from kind of public surveys and even anecdotes, is that once both our members and our provider network tries telemedicine in general, they are much more likely to want to do it in the future. I've spoken to primary care docs who said, I never believed in any of this stuff. I thought you could never do anything like that. But now that I've tried it, there is a ton of utility to it. So I think it's clear that we are going to be in a different phase, and telemedicine is going to be a much bigger part of how we practice in the future. I think where sometimes overhyping comes in is, a televisit is not the same as an in-person visit. There is value to being able to do a physical exam and to being able to do different kinds of interventions and getting therapeutics or diagnostics on the spot. So it's not that telemedicine is going to replace an in-person visit. I think it's more that it's going to better complement and allow for different kinds of care. Now I'm sure we'll get into it later, but even if you start to think about changing the way you pay for these types of things, you could envision where before, you might have somebody who's chronically ill coming in once every couple of weeks or a month, and losing half a day of their work, or if they're working, or kind of making it hard to work because actually they're spending a lot of time in waiting rooms. To say maybe spacing it out a bit more, but having a lot of check-ins in between. You can do 5-minute check-ins. You can have telemonitoring and understand how their blood pressure or weight or breathing is doing. Those kinds of things, I think that's the opportunity for us to take. It is possible that we squander this opportunity, but I certainly don't want to. And I think for us, it's really about how do we take advantage of this opportunity to improve care, the way care is delivered.
So just to put a button on this before we transition to what Ravi was alluding to, and Rodrigo, you talked a little bit about as well. There's obviously a regulatory environment. There's obviously payer arrangements, and things that are different now than they were 5-6 months ago. So we're gonna get into that. But I guess from a CEO client of mine, provider in the physical therapy space, he put out an article in a business journal indicating, look, there's better access to routine care, which I think, Rodrigo, I'm hearing you saying, better access for, remotely located people, which to a certain extent, Ravi and Gulshan, you were mentioning that, even just out of your nucleus, you have a farther reach now, and better access to healthcare professionals who would otherwise not be accessible, either because of appointment overload or just physically not able to go. So I guess real quick around the horn, I mean, agree, disagree with that perspective? Is that new? Is that old? And if you disagree, what do you see? So I guess we'll just start again with Gulshan and go real quick through Ravi and Rodrigo.
Yeah, no, I think that's consistent with what this panel's been discussing in general. I completely agree. I think better access to care and care at a distance in a safe manner, and being able to go out and allow for that through use of technology. That's exactly what this is all about. And I think that's the opportunity here that we definitely don't want to go out and squander. We want to go out and utilize this as best as possible.
I agree with everything you said, Mike. That was a good summary.
Anything else, Rodrigo?
Yeah, I think access is access to healthcare is a big problem all over the country, and also it's very unequal depending on what region you're in. If you even look at Philadelphia, downtown Philadelphia has a lot of doctors, but I think as you go outside of that downtown, it changes a lot, and people are driving 1 to 2 hours to come into some of the hospitals in our area. And you have to imagine that we can do better than that, and telemedicine will help there. I think the other aspect of access is that not everybody. There are still access inequalities in virtual health. Not everybody has audiovisual capabilities. We've seen that particularly with our seniors who have had difficulty accessing audiovisual visits. And one of the things that, for example, for an annual wellness visit and being able to appropriately reflect the risk of our patients, CMS has required audiovisual, and our seniors just don't have it or can't get it to work. The same in terms of lower income, lower resourced environments having access to good internet, and again, computers or smartphones. Sometimes it is an issue. But yes, this is a tool that we've had and we've underused, and now is our opportunity to really make progress.
Yeah. So, kind of moving into our next phase, what the role of regulations, payers, all of that affecting this. This is now out of Pandora's box, right? Rodrigo, do you see this getting put back in any significant manner, or do you see the payers and the regulators, particularly the cross state line issues? Do you see that continuing to figure out best practice and what's best for the consumer, and that's what's going to drive this continued evolution, or do you think that really it's just whatever the payers and the regulators think is best, they're going to do it? So I guess, is it consumerism driving in it, or is it the structure around the the regulations and the payers? Kind of what's the talk behind the scenes?
The reality is it's probably an and to all those things, right? It's not an or. For CMS, Center for Medicare and Medicaid Services, plays a really important role in regulating. I think they've loosened a lot of restrictions on the cross state lines, and in the setting of the public health emergency, allowing payers to change things that they might not have. So for our commercial plans, we can make changes in the middle of the year if we want. Particularly kind of adding benefits for Medicare Advantage. We put in a bid. That bid's already in for all payers that are trying to put out Medicare Advantage plans, and those benefits are sort of in now. In the public health emergency, we have been able to add, because CMS allowed it, we have been able to add a lot more access to telehealth. But you have to imagine that if CMS doesn't allow that expansion or sort of expect that out of Medicare Advantage plans, there are a lot of plans who have already submitted a bid where, once that public health emergency is over, their hands are going to be tied. They really can't offer the telehealth benefit. That said, we recently had an executive order, and everything you hear from the CMS administrator Verma and others, this is, they're sort of saying this is where we're going to go, and the expectation is that CMS will be more allowing in terms of their our ability to access telehealth. So I think that it's going to happen. On the consumer side, like I said before, members are asking for it, and so are providers. I think the issue of state lines, I've dealt with that as a clinician, and then having to go through the relicensing process, and it is a headache, and it involves paying tribute to various different entities that will sort of give you the ability to practice in one state or another. I think a lot of the safety arguments and all that. When we relax these, I'm not sure. I've not heard of any safety issues with that. It may be that we go back to having those state line restrictions, but again, it's not as clear to me. And I guess this is a natural experiment where we can actually verify. Yeah. But I would want to look at the results of what's happened here and see whether all the fears of allowing kind of cross-state practice have materialized. And my suspicion is that it hasn't. So not great rationale for keeping that in place.
Yeah,
personal opinion.
Ravi, you have people investing in this, right? You have customers and people making decisions of, how permanent or how not permanent this is part of their business. How are you advising them? What are you concerned with? And, do you see some abrupt changes, that you're trying to help your either internal staffing or your customers plan for, if they do pull the string or recoil some of these things that have allowed for essentially such ease of the platform right now?
Yeah, I think I'll take a step back to, I think, an interesting question you asked about consumers and who is driving this change. If you look at, just our society at large, things have changed with democratization of data. I think consumers are really playing a bigger role than ever before in terms of how businesses and government responds. And I think so if you take a look at any survey prior to the pandemic, there was a high level of dissatisfaction with the consumer experience of healthcare. I think we were not happy just with the returns overall, the costs and everything. There was a high level of dissatisfaction. And I think consumers were very quick to adopt to the retail concept of healthcare. So, I think my belief is consumers are going to embrace telehealth. And I think that's going to be equally driving how CMS and others respond. So consumers are an important part of this. Now, one outcome of this pandemic is there is a reduction in the overall avoidable doctor visits. Things that in the past you could just say, I'm going to go see the doctor. Now, you're thinking twice for, the obvious reasons. But some of these avoidable visits, and I think Gulshan mentioned this, you can have a quick telehealth call to turn this, into probably a different kind of visit. So I think that's one thing the pandemic is doing. Now, there are, I think, things that are going to require physical interaction, whether it's an annual visit or even getting a swab or a blood test, you still need to go to a doctor. So when you talk to businesses, I think there is going to be different business models, a hybrid business model, where maybe some part of the healthcare experience is provided through telehealth, and other aspects still require, someone to come see a nurse or come see a physician for part of the telehealth. So what is the advice to provider organizations? We need to embrace telehealth, but are we going to an all digital virtual front? Some industry, like in behavioral health, I think there is greater potential. But in other places like the primary care, I think a hybrid model where telehealth is more a treatment extender, I think is advice that that we are hearing as well as sharing with our customers.
Thank you. So Gulshan, I just to touch on one more thing in this category. Value-based care is a huge topic, right? How does this fit in to that? And what are you seeing at Children's National, or maybe even just from the perspective of similar providers and wherever you are in the country who are kind of faced with this shift from a typical fee-for-service environment to a more value-based reimbursement, and their telehealth and the quality of their just call it virtual care, plays into them meeting all the necessarily qualifications to ensure reimbursement.
Yeah, I mean, it's a good point. I mean, I'll give you a technologist's perspective. That's who I am. That's what my team primarily goes out and does, as opposed to a little bit of that provider sort of aside. I mean, that's who we serve to a certain extent as well, right? I mean, we are often inclined to go out and skate to where the puck's going to be. And for a little while, there was an initiation and perhaps a little bit of a plateauing of the value-based care world. All focused primarily on the volume side of things, especially in a Medicaid population like what Children's National serves over here. It ended up being mostly volume oriented. What we saw with the pandemic is a tremendous amount of volume disappearing. Obviously, this has happened nationwide as well. Telehealth is one way for us to have brought back some of that volume, but the reimbursement patterns didn't completely go out and match the in-person a volume that would have existed based on some of the technical fees and so on and so forth, right? So it didn't go out and quite completely go out and make the organization whole just by having telehealth as part of that. So we know as far as what the future is, and we're hopeful, and we were kind of skating towards that, if you would, is that there is going to be a greater prevalence and a greater possibility for value-based reimbursements to have another say in this market, and not just Children's National. This is where I'm speaking a little bit more, nationally across provider segments at the moment as to what the technology is going to go out and enable. Data fluidity and data liberation, data democratization, as Ravi said, all of that, we've had that. We've been able to do that. Our platforms go out and support it. We've been actually holding our vendors accountable to make sure that a lot of the data is interoperable and so on and so forth. And that allows for us to go out and look across the continuum, across different systems, and provide a greater view of a longitudinal record of a patient, and being able to go out and understand how best the value-based reimbursement patterns could be optimized through more geared contracts and so on and so forth. So that, I think, the regulation side, that's one of those aspects that I'm expecting. I think there's also a little bit of is there going to be any pullback on the telemedicine side alone from a regulation side, right? I mean, so the cross-state proliferation of being able to provide services and the initial thought about being able to go out and expand your geographical reach, is that going to be hampered by any of the reimbursement related restrictions that perhaps come through CMS or others, right? So I think there's an incentive there. One thing from a regulations perspective that we would love to see, and just because, again, as a technologist, we would like to get technology out in the hands of the consumers and their families as much as possible. So I think Rodrigo mentioned this a little bit earlier, where access to technology, that go out and play a factor in terms of access to care at that point. We would love for there to be more consumer advocacy, and we would support that. And we do that through Children's National on an ongoing basis, especially within the region, for the populations that we serve, that we would love to have an ability for more folks to have access to technology that allows us to not only have telemedicine related business, but also just digital health in general, right? The care at a distance is going to be really important. And there are additional capabilities that we would like to enable within the palm of a consumer, if you would, in order to interact with their care providers, and care providers a little bit more robustly than perhaps they can right now, with maybe a little bit more of a limited access that they perhaps have. So anyway, a few different areas from a reimbursement regulations perspective, but as a technologist, I'm pretty excited about it. I just don't want to be hampered by it.
Understood. But I think you provided a good lead into our last point here. The future of digital health, the digital information, all of those things. Again, we talked about the spectrum varies. It's this platform, it's smart devices, it's capturing and sharing patient data real time with all kinds of monitoring, inpatient, outpatient, you name it. There's a whole lot of aspects of it. There's a whole lot of data behind it. I guess, Ravi, what are some of the risks? We talked again, before, privacy. I mean, that's got to be a big thing, right? What's going on with all this information? The interoperability, people sharing information amongst health systems and providers and different parts of the country. What's going on with all this information, and what are your concerns, from Core Solutions perspective?
Yeah, I think security is a big concern. But to put things in perspective, we'd have to look at how much data we collect in a day. I think, like I read some numbers, like 2.5 quintillion bytes of data is being collected in a given day. And if you think that's like 10 million Blu-ray discs, that you stack everything up, it's 4 times the size of the Eiffel Tower. That's the amount of data that we collect in a given day. So there's a significant amount of data, which is both good and a challenge. I think in order for healthcare to leverage data, I think we need to bring data from multiple perspectives: the physical health, the behavioral health, and the social data. I think there's a lot of focus on social determinants to health. And bringing this data holistically, I think, is critical to create value through this data. So data is key, but how do you bring this together? There are still significant barriers. While I think we have made significant improvements in interoperability, data is still not as easily interoperable as especially in the smaller providers. Interoperability is still a barrier. And also, a lot of the data is not as standardized on the clinical side. So the positive side is, the AI and other advances in technology is just allowing us to leverage unstructured data in ways that we never had before. So while we make a move towards interoperability, standardization, I think unstructured data is creating a lot of value today, especially with the amounts of data. So when all of this comes together, what can we do with this data? I think we can identify risk early. We can reduce expensive care. And I think we can proactively live healthier lives. I think the number of people who have this goal of walking 10,000 steps a day, that's a proactive way of being healthy. And that's driven through data, through research. And I think, those are examples. Now, on the business side, I think there is significant opportunity if you're an investor looking to invest in companies. I think what are the things that can truly disrupt this market? Tools to leverage data and put this at point of care. Given the number of medical conditions, I think there are so many different specialized companies that just focus on one medical condition. and they integrate that specialized knowledge, the data and technology to bring clinical decision support, in the hands of the consumer, in the hands of the care provider. So I think that's a great business opportunity for anyone with specialized healthcare knowledge is interested in bring that together. The other example for business opportunity is using AI and analytics to automate, things that are expensive and time consuming. For example, now radiology reports can be read through AI. We don't have to do the manual work. Similarly, there is a lot of AI work happening around blood test results. Instead of someone listening and looking at the data, AI can identify, risk. Now, the last example is, creating disruptive business models. For example, multilingual transcription service. There are services coming out that can listen to the clinician conversation and create clinical notes based on that conversation. So the amount of, productivity that could generate is pretty significant. So, Mike, to your question, data is going to drive the future of healthcare. I think there's an opportunity to disrupt how we do things, bringing together technology and data along with healthcare expertise.
Excellent, thank you. I guess, Rodrigo, from the standpoint of Independence Blue Cross, I mean, where does this data come into your business decision making? Things that you're doing within the company and outside of the company, and kind of what's your perspective on, where the investment opportunities are, whether it's payers making investments or providers making investments, or patients making investments. Where do you see that opportunity?
Yeah. I think being able to integrate all the different sites of care and bring data from a variety of different settings is a huge opportunity, and really would help. As a payer, I think, and a lot of people at Independence think that really this is our opportunity to help our members navigate the healthcare system, which is very hard to do today, and to integrate a variety of sometimes really disconnected provision of care. This is a big deal. We're going to be talking actually later today within Independence on where do we want to make these types of investments. If we can sort of take that data in from remote monitoring, and we have a health share exchange in the area, and that can help us, if we can use advanced analytics to better target the types of interventions that we have, and a proactive public health interventions, that really could be a game changer for us. Because, like anything in public health, the more targeted you are, the more effective and the more cost-effective that intervention can be. So I really, I think that this is a huge opportunity. And, to your question earlier about value-based care, I think if we can really get this right, on the data and virtual care perspective, this is a great tool for that. We see that there is the data collection and analytics piece. But I think it's also the other piece we would invest in is how do we help that kind of end-to-end journey, to help somebody decide what's the right setting of care at the right time with the right person, to helping them manage their chronic conditions, and kind of integrating all those things so that when they have a problem, we can help them get to where they need to go.
Thank you, Rodrigo. Gulshan, I want to hear about where you think the investment opportunity is as well, but you did mention interoperability. One thing I was reading about telehealth, are the feds going to address this privacy thing? Are they going to make it more uniform across the country? Is it going to get into the consumerism? Right now it's the data that's within the health system is HIPAA protected, but what about things that are captured in the consumer world, right? So, are they going to fix this across the provider spectrum from the data standpoint? And then, where do you see opportunities, in the future of digital health, for people looking to place some money somewhere?
Yeah, I mean, I think overall, it's So there's the acquisition of the data, and we've talked about just the amount of data exhaust, the healthcare data exhaust that actually happens, which probably goes unlooked at, or we don't really get a chance to go out and have true insights being delivered from it. Being able to understand, and I think I don't want to go out and make this a marketing commercial for Teladoc, but considering Ravi mentioned it about 4 times earlier, I'll go out and talk about it a little bit. Their collaboration with Livongo is just one of those canary in the coal mine kind of signs, right? And everyone wants to go out and understand how do you go out and complete the ability of providing care at a distance with technology that gets all the way to the point of the producer of that data, which is actually the consumer of that data, or consumer of healthcare in general. Being able to understand how do we bring analytics not only from a provider and a payer view, and being able to drive some insights over there, but being able to go out and bring some of those insights directly to the consumer of healthcare. So being able to understand some of the data that is being generated by those patients and the consumers, and being able to make that actionable for them to take care of themselves a little bit better, without a care provider being able to be in the mix and being able to go out and intervene over there. I think that is really powerful as well. The question historically has been, when you take that sort of a view of things, can you make a business model support that, right? So far, all of those companies, all of those startups and such, they get paid by either the payer or the provider. No, we don't really have too many of these out there who are only are in a little bit of a subscription model, which are truly patient focused, right? So will the patients go out and pay a certain amount in order to go out and get the insights about their health on an ongoing basis? So the business model for some of those startups has yet to mature or get to a point where it's convincing enough that can actually materialize. But there is an opportunity there, and I think it's an opportunity that needs to go out and get greater scrutiny and perhaps get unlocked a little bit. So being able to go out and bring insights directly to the consumer about their own health and their data, outside of just the free stuff to a certain extent that's available through Apple Health and others, right? I mean, I think that's the kind of work that is going to be that should be explored a little bit more by those who are looking to invest in that field. Overall, we talked about AI and machine learning and everything else, right? I mean, I think there is a certain sense that the information blocking regulation that came with the 21st Century Cures Act, and that goes into effect later this year and then back in 2022 in terms of ensuring that all of the providers and as well as the other organizations that have any consumer health data, any patient health data, any PHI at all, are able to liberate that and aren't seen as blockers to restrict accessibility to some of that data and so on and so forth. So we as an organization at Children's National, as well as at Cerner at large, I think we pride ourselves to be very interoperable, and we want to be able to make sure that accessibility to this data in general from our core EHR platform, which is Cerner, as well as all the other ancillary systems at Children's National, all of those combined together, we're not seen as data blockers because we want to make sure that the data is available in the format that is most convenient to the consumer of that data, but while making sure that privacy never gets compromised. So all of those are tough answers to get to, but that's a work in progress for us to get there, and we're pretty excited about that as well. This is another one that's going to go out and define us over the next couple of years.
Thank you. Yeah, it is a difficult question. I think you did a great job at addressing it, but we could stay here all day and talk about this. I could certainly sense the enthusiasm of you gentlemen, and I really appreciate you bringing that today. We are at the end of our time. Again, thank you very much for your participation. I think this was really insightful and hopefully gives some of our attendees some ideas about where things have been, what's going on right now, and what the future may hold in this environment. So thank you, and this concludes our healthcare session. And back to you, Tom. Thank you very much.
Well, I'd like to extend a warm thank you to all of our panelists and, of course, to our moderator. I'd also like to invite everyone to tune in to the next broadcast episodes to see the featured company presentations and, of course, the Lion's Den finale. But right now, I'd like to invite everyone to join our panelists in an informal networking session for the next 30 minutes, immediately following the closing of this session. So on behalf of PACT and of Independence Blue Cross, thank you all for attending.
On your screen now, you'll find a QR code to access the virtual networking room powered by Remo. Please use this QR code to enter the networking now. We look forward to seeing you there.